Although they come from many walks of life, these people share some special traits. They're active, they have positive attitudes, and they enjoy living well. They also live with diabetes.
Based on my experience in developing diabetes, I would tell anyone it's not the end of the world.
It will get better. You will get control. It'll become a part of your life instead of the central focus of your life. You will learn how to manage it.
At the beginning I thought, well, what's the use? This disease is going to kill me. But then I thought, no, I'm not going to allow it to happen, not for a long time. As long as I can take care of myself, I'm going to do the right thing.
More than 16 million people in the United States alone have diabetes. It's a disease without a known cure, and it can produce severe complications. This sounds frightening, and uncontrolled diabetes can be dangerous. Fortunately, your condition is controllable. With treatment, you'll be able to work, play, feel well, and live well. It's also good to know that you are a key part of the treatment process. In some cases, the disease can even be reversed by lifestyle changes. And in every case, the first step is understanding diabetes. There are several different types of diabetes. Type 2 diabetes is by far the most common form of the illness. In fact, over 90% of people with diabetes have type 2 diabetes. Type 2 is also called adult-onset diabetes because it usually occurs in people over 40. Type 2 is non-insulin dependent. Treatment is centered on dietary changes and regular exercise. However, diabetes pills or insulin may be required. There are two less common forms of diabetes. Type 1, or juvenile onset diabetes, usually begins in childhood. Type 1 is insulin dependent, which means that insulin injections are needed every day. Gestational diabetes is brought on by pregnancy and usually disappears when the pregnancy is over. Although 30 to 50% of these women remain at risk to develop type 2 diabetes later in life, a risk which increases with weight gain and lack of exercise. All people with diabetes have a problem with a hormone called insulin. Normally, insulin is produced in the pancreas and released into the bloodstream where it works like this. When you eat food, your body breaks it down into a sugar called glucose. At a cellular level, glucose is your main fuel. Insulin unlocks cells so that the glucose can enter. Then the cells burn the glucose, providing energy for the body. Without energy, the body can't function well, and this is the trouble with diabetes. The pancreas of a person with type 1 diabetes does not make insulin. People with type 2 diabetes do produce some insulin, but their bodies can't use it properly. The insulin doesn't unlock the cells, so the glucose can't get in. The extra glucose accumulates in the bloodstream and spills into the urine. This produces the characteristic symptoms of diabetes. Unusual thirst, frequent urination, and fatigue are the most common symptoms. Some people also experience sudden weight loss, blurred vision, and other problems.
I felt thirsty all the time, and I felt kind of a tingling fingers and feet, and I said, what's wrong with me? And that's why I went to the doctor.
I got diabetes I think it was about 3 or 2 years ago. And what happened was that I was losing a lot of weight, and I was feeling very tired, and I lost about 10 pounds in 2 weeks.
None of the diabetic damage to the back of the eye. Okay, why don't you take off your glasses for a minute?
Okay.
With type 2 diabetes, many people may not have any symptoms at all. and this can make it hard to accept a diagnosis of diabetes.
The people who have no symptoms are usually in disbelief because they feel perfectly fine, and many patients with chronic diseases are diagnosed in an asymptomatic stage.
I really didn't believe it, frankly. I felt too good.
Whether or not symptoms are present, diabetes can be detected by a simple blood test. The test measures the amount of glucose in the blood before or after a meal. As we've seen, excess glucose accumulates in the blood of a person with diabetes. So someone with diabetes will have a higher blood glucose level than someone without diabetes at a similar time. Taking control of your diabetes is the key to a long, healthy life. With the help of your healthcare team, you'll gain the knowledge and skills you need to feel well and live well.
It has to start with diabetes education. That, again, this is a disease like no other in terms of being able to do self-management, to learn how to take care of yourself. So in order to do that, you have to have an education to back it up.
To care for yourself, you need the facts, and you need the support of a good healthcare team, including doctors, nurses, diabetes educators, dietitians, and other caring professionals. They can answer your healthcare questions. Learning to manage your condition will pay off in many ways. By following your treatment plan, you'll increase your confidence, your comfort, and your safety. Here's how. Proper nutrition and exercise are the most effective treatment for diabetes. They help to control your blood glucose level and aid in weight loss. For many people, this is all it takes to control their condition. Self-monitoring will help you keep track of how well you're doing. By checking your blood, the effectiveness of your treatment can be assessed. In some cases, medication will be required. Depending on your needs, your doctor may prescribe diabetes pills or insulin injections. These 4 points are the cornerstones of diabetes management. Now, let's take a closer look at the beneficial effects of a healthy diet and regular exercise. Your food choices have a big impact on blood glucose level. For example, high-fiber foods actually reduce blood glucose levels and insulin requirements. Calories, portion size, and the timing of your meals also affect your glucose level. So too does the amount and kind of carbohydrates you eat. The foods that will help you control your diabetes are the same foods that everyone should eat to be healthy. But with diabetes, it's even more important that you have a plan to eat well. A registered dietitian or diabetes nurse educator can help you create a meal plan to fit your needs. It's also a good idea to check in once a year to make sure your plan is still working. Of course, there's more than one way to manage your diabetes meal plan. Some people use an exchange plan, others use the food pyramid, and some count carbohydrates.
A lot of people are confused about all the different diets there are out there. The thing I like to have you keep in mind is that you can basically eat anything that a person without diabetes can. It's just that you need to learn to eat certain foods in smaller portions, eat frequently, don't go long periods without food, and the best help you can get is from a dietitian who'll sit and make a personal plan for you.
No matter what diet plan you choose, here are some important tips to keep you on the right track. Avoid overeating. Don't skip meals. Eat a variety of foods. Limit simple sugars. Instead, focus on complex carbohydrates such as whole wheat, brown rice, and oats. And learn how to cook low-fat foods.
The treatment plan that I am taking to manage my disease is mainly exercise and diet. My wife is very good about giving me low-fat foods. It hasn't seemed to make much difference as far as sugar is concerned. It's mainly the low fat.
In addition to controlling blood sugar, good eating habits will help you reach and maintain a desirable weight. Many overweight people with type 2 diabetes improve after losing as little as 10 pounds.
However a person became overweight, once you're carrying too much fat, your body is likely to be resistant to the insulin you make, and so for people with type 2 diabetes, their blood sugar levels go up. If you can make changes to your lifestyle that will reduce the amount of fat you're carrying, then those people get a dramatic improvement in their blood glucose levels.
Along with diet, regular exercise, moving your body for 30 minutes a day is the key to weight management and good health. Exercise makes insulin work better, so there's less need for injected insulin. Exercise also helps your body use glucose more efficiently and can lower tension and stress, which can affect your blood glucose level. And of course, exercise improves your physical condition by improving circulation, blood pressure, and muscle tone. In short, exercise is good for everybody, especially for people with diabetes.
Well, it's a godsend, really. It has done more for my morale and everything else than anything I could have possibly done.
It's like a vicious circle. You're tired, you don't want to walk, so you sit more, and your sugar keeps going up. It doesn't matter if you're on a diet. But the combination of the two is what works for me.
As you've seen, good nutrition and exercise can do a lot to control diabetes. For some people, lifestyle changes are enough. For others, medication will be a part of their treatment. Every case of diabetes is different, and to make sure that your treatment is working, your condition must be carefully monitored.
The glycohemoglobin is a test that a doctor can perform in their office that allows you to determine what the overall diabetic control has been over the last 3 months. I call it the diabetic report card because it gives you the blood sugar average for the last semester.
It has been shown that high blood sugar levels can result in the development of long-term complications, such as blindness, kidney failure, and foot problems. However, if you work closely with your doctor, you may prevent or decrease your chances of developing these complications. Glycohemoglobin, or hemoglobin A1C, is a test done periodically in your doctor's office. But you will also learn how to check yourself. The best way to do this is to keep your pre-meal and fasting blood sugar within your personal target range. If you do not know your target range, please speak with your doctor. Monitoring your blood sugar is quick, easy, and more accurate today with products such as the Accu-Check Advantage Meter. To get a drop of blood from your finger, follow these simple steps. First, wash your hands and dry them well. Place your arm lower than your heart for 30 seconds so blood can flow to your fingers. A tip to help you get a larger drop of blood is to use a rubber band around your finger like a tourniquet. Hold your hand palm up and collect some blood from your finger. From this point, follow the instructions that come with your testing kit. After you've tested your blood, it's important to log the results. This information provides an excellent yardstick. Your doctor can see how you're doing and if your medication needs to be adjusted. Your healthcare team needs your records to help you win.
If you just go to the doctor and you say, well, I don't feel well, and you say, well, how much was your sugar in the last couple of days, and you don't test your sugar level, then you don't know. So, you know, she's not a magician.
I have no magic wand, and there is no crystal ball. There are certain predictions that we can make about an illness, but a large part of patient outcome will be determined by the patient, how well the patient can run the race.
As we've seen, the major treatments for diabetes type 2 are diet and exercise. But if your blood tests indicate that you need more help, effective medications are available. Diabetes pills stimulate the pancreas to make more insulin, and they help the body use existing insulin more effectively. To get the maximum benefit from diabetes pills, it's important to eat on time. And even though side effects are rare, you should know what to watch for. You also need to know the signs and symptoms of a low blood glucose reaction. a complication that will be discussed in detail in the next segment. If your diabetes isn't controlled by diet, exercise, and diabetes pills, then you may need to use insulin, such as Humulin, at least temporarily. Insulin, the substance used by the body naturally, is the most effective blood sugar lowering drug available today. Insulin allows patients like you to return their blood sugars and hemoglobin A1Cs to non-diabetes levels 90 to 100% of the time when used correctly. In addition to insulin's ability to improve blood sugar control, it may lower fats and make you feel better. Insulin can't be taken as a pill because it is destroyed by stomach acid. That's why it must be injected.
Don't be afraid to inject yourself with the insulin. The needles that they have now are so fine and so small, and the places they have you inject the needles, it's no problem at all. I didn't think I could ever do it. I really didn't. I objected to the fact that they were going to make me do insulin shots. I can't do that. Well, I can, and I think anybody can.
If you need insulin, your healthcare team will teach you how to give yourself shots. Most people find that injecting insulin is far easier and quicker than they had imagined. And better yet, the insulin will keep your blood sugar at a healthy level. If you are concerned about measuring the proper amount of insulin, there are new devices that are easy to use. Cartridges and pens make it simple to dial up your correct dose of insulin and inject without needing a vial or syringe. Simply dial and dose. Feeling great is the best reason there is for following your treatment plan. Nobody can take good health for granted, but people with diabetes have several special concerns. Your treatment plan can help prevent complications from diabetes. Complications result from an imbalance of the amount of insulin and glucose in the body. One serious complication that you'll need to be prepared to handle is hypoglycemia. Hypoglycemia, or low blood glucose, is a complication that occurs when blood glucose levels get too low. It's important to learn the warning signs of hypoglycemia. You may experience feeling spacey or not totally with it. Hunger, rapid heartbeat, sweating, and irritability are other signs.
Well, if you get hypoglycemia, you're going to feel pretty strange. You might get shaky or hungry or sweaty or feel nervous or crabby. And most people get a pretty intense feeling that they know something needs to be done. The wisest thing to do is to test your blood sugar first. But if you're not able to, or if you don't have the meter to test it, you need to drink something or eat something with sugar in it right away.
If you experience hypoglycemia, here's what to do. Eat an emergency food right away. This can include 4 ounces of fruit juice, 8 ounces of milk, 4 ounces of non-diet soda, 5 hard candies chewed well, or 2 or 3 glucose tablets. If you can, test your blood glucose 15 minutes after eating. If it's still low or you still have symptoms, repeat the process. If it's going to be over a half hour until your next meal, eat some solid food, like a half a sandwich or some cheese and crackers. And if your blood glucose stays low, call your doctor without delay. Another serious complication you need to be aware of is hyperglycemia. Hyperglycemia, or high blood glucose, comes on more slowly, taking hours and sometimes days to develop. However, if you experience increased urination, excessive thirst, dry skin, or fatigue, notify your doctor.
Do you check your feet every night to make sure you don't have any sores or those sorts of things?
Another concern is preventing infections. With diabetes, small cuts can develop into severe infections that heal very slowly. Foot problems are especially common in people with diabetes. This is why it's important to take good care of your feet. Your podiatrist will set up a foot care program for you, but in general, follow these guidelines. Wash your feet every day in lukewarm water. Don't soak them. Be sure to dry your feet well. Dry between your toes. If your skin is dry, use a moisturizer after you dry your feet. Don't put the moisturizer between your toes. If you have problems with sweaty feet, dust them with a mild powder. It's important to check your feet every day. If you can't see well enough, have someone else check them. Look for sores, cuts, blisters, cracks, rashes, or ingrown nails. If you find a problem, wash the area with a mild soap and water. Dry carefully and wear a clean white sock as a bandage. Call your doctor about the problem as soon as possible. To keep your feet healthy, you should invest in well-fitting, sensible shoes. And don't smoke. Smoking damages the small blood vessels in the feet. People with diabetes can also experience certain chronic complications. These include eye disease, kidney disease, heart disease, and nerve damage. However, by controlling your condition, you may reduce the severity of any complications or prevent them altogether.
One of the most important studies in the past several decades is a study which has shown that for people with diabetes, the closer they can keep their blood glucose levels on average to normal, the lower they can keep them in the long term, the less likely they are to have many of the long-term complications of diabetes.
While not everyone with diabetes suffers complications, these possibilities are frightening to think about. And even without complications, a chronic illness can be very hard to accept. Without doubt, diabetes has a profound emotional impact on people. Controlling your condition can help you feel better emotionally, but the emotional effects of diabetes deserve special consideration and support.
It was what seemed like the worst thing could ever happen to me. It was a really stressed out moment for me. Matter of fact, a couple of tears dropped in my eye. I couldn't believe that I had diabetes and it was not going away.
I didn't have the fear, I had the grief. Sitting around, woe is me, that type of thing. And one day I decided, Lorena, you've got to come out of this, and I have been stepping ever since.
Well, the new supervisor is working out okay.
At some point, everyone with diabetes will have some difficulty dealing with the day-to-day management of their condition. At these times, emotional support can make the difference.
And so as we've gotten new people into our diabetes support group, one of the things that I've tried to tell them is, I know how you're feeling now. Every one of us have walked this path, but it will get better, and you will get to a point where diabetes is part of your life, not the entire life.
Oh, that support group down at the center, just out of this world, in that when I first come out of the grieving spell, I decided I'll start there. And I would go to the different activities that they had. And then at church, oh, they're wonderful too. They will come alongside whether they think I need it or not, just to talk.
My daughter gave me support. She's the most important person in my life. And then she supports me, and she goes along with the diet plan with me.
I'll just put that here for now.
I have one support person, and that's my wife. And without her, I don't know what I would have done.
Emotional support will help you accept your illness, but that's just the beginning. Emotional support can also help you find the attitude and energy you need to take care of yourself. Living well is an art and a challenge. Living well with diabetes is up to you.
There's a silver lining to diabetes, and the silver lining is that often you end up a healthier person than you started out, than you would have been if you hadn't had the diagnosis. I think I can honestly say that about a lot of my patients.
I take a personal reward in knowing that I feel good about myself. My weight's under control, I look better.
I lost weight, and I think I look better. I was very ugly, you know, with all that weight on me, and now that I lost weight, I feel a lot better.
By now you've seen that diabetes can be controlled, and you have a good idea how to control it. Living well with diabetes starts with an understanding of the disease. It requires a good working relationship with your healthcare team, commitment to your treatment plan, and plenty of emotional support. Your doctor may head up your healthcare team, but you are the most important player. Every day, you're on the front line with your body, calling the plays as you go. As these active, vital people can tell you, the rules are simple. When you take charge, you win.
I am managing this. I am not sitting around waiting for someone else to take care of me. That's my responsibility. And so I think that it has helped me to be a little more self-sufficient. And sometimes when other things come into my life and I think, oh, I'm kind of scared to tackle this, I think, wait a minute. You manage the diabetes, you can handle this too.